As previously stated, all types of diabetes will require nutrition management. In general, medical nutrition therapy for diabetes is individualized. It's based on the type of diabetes, the extent of the control of the diabetes, and treatment goals. For example, some diabetic patients may need to lose weight. They may need less carbs, lower fat. They may need to be calorie restricted. Sometimes Mediterranean diets are effective that are adapted for diabetes care, specifically for patients who have cardiovascular disease. Sometimes patients who are diabetic have had bariatric surgery. They're on certain medications. Some will adopt a meal replacement strategy. So again, the diet needs to be individualized. However, close monitoring of the effects of the diet on the patient's renal function, blood lipids, blood pressure, and blood glucose need to be taken into account and adjustments made where necessary. Behavior modification and exercise prescriptions are also essential. Although it's beyond the scope of this course to discuss it, exercise considerations come into play when we talk about things like resistance training, foot strike, degree of intensity, and so forth. Exercise can have unpredictable effects on blood glucose. For example, adrenaline can increase blood glucose, but exercise also increases insulin sensitivity, with the consequent result of lowering blood sugar. Type 1 patients must especially take care to prevent hypoglycemic episodes. If pre-exercise glucose is less than 100, the patient should eat a carb exchange. Hypoglycemia is a rare problem for people who are not on insulin. Again, patient evaluation prior to beginning an exercise program, including heart, podiatry, footwear assessment, and other issues, should be taken into account. Patients who are in ketosis should not exercise. Most cases of type 2 diabetes can be prevented or delayed by following the guidelines presented on this slide. If a patient has an elevated glucose and A1C but not enough for a diagnosis of full-blown diabetes, he or she should receive counseling to reverse the march toward outright DM. This is especially critical for children who will often experience diabetes at a younger age and the consequent comorbid conditions. Again, 7% weight loss, 150 minutes a week of moderate to vigorous physical activity, lower calories, saturated fat, and total fat, adequate fiber, elimination of sugar-sweetened beverages, and in some cases, a diet modification to lower hypertension. There are specific goals of medical nutrition therapy. The first and foremost is to maintain and sustain blood glucose levels in a normal range. We also want a lipid and lipoprotein profile that reduces the risk for cardiovascular disease. And we want to get blood pressure levels within the normal range or as close as possible. These are the three specific goals of medical nutrition therapy. We also want to prevent or at least slow down the rate of development of the chronic complications. We want to address individual nutrition needs and maintain the pleasure of eating, not only by limiting food choices, but we want to include foods that would be cardioprotective or protect bone loss or just promote a general sense of well-being. There are basically three levels of intensity of medical nutrition therapy in diabetes. For the patient who has impaired glucose function, what we call prediabetes, or to prevent type 2, the MyPlate or plate method is a sufficient management tool. We simply want to make sure that the patient eats a consistent amount of carbohydrates 3 to 6 times a day, not in excess, and in some cases to induce some weight loss. Monitoring blood sugar to make sure that their bodies are responding well to this type of therapy is also in order. Moving up a bit, someone who has type 2 diabetes may be able to control their blood sugar and A1C level by managing on a controlled carb diet, where the patient has a set amount of carbohydrates given at breakfast, lunch, and dinner and snack time with close glucose monitoring. An oral agent might be needed, but again, we're avoiding the insulin. The third level of management is an insulin to carb management for patients who do require insulin injections. In this case, we would actually match the exact number of carbohydrates to insulin dosages to keep the blood sugars and A1C normal. Again, adjustments may be needed to achieve our goals. Generally, the diet's carb controlled. It's moderate in protein to spare the kidneys, and 30% of the calories or less are from healthy fats to prevent heart disease. The diet should be plant-based. It should restrict or reduce alcohol to an absolute minimum. We want to avoid fast foods and eat foods that are prepared by the individual. When a patient takes control of the food that they're actually eating, they also tend to have much better control of their blood sugar. Carb consistency is paramount to prevent the highs and lows in blood sugar. Patients can learn how to estimate carbohydrates in foods or learn to read food labels, and there are also special apps that can help determine the amount of carb in a meal. Generally speaking, the estimation system is used, and they count a carb exchange as 12 to 15 grams of carb per serving of food. That's very important to remember. For example, a slice of toast, an apple, a glass of milk, a cup and a half of green beans, they all have about 15 grams of carb. A man generally needs between 5 and 7 carbs per meal. That's a range of 75 to 105 grams per meal. And women need about 4 to 6 carbs per meal. This works out to 60 to 90 grams at a mealtime. Of course, these amounts would be reduced in patients who need to lose weight, as you can see on the slide. The diabetic patient learns that they have to have so many carb choices at their meals and snacks. You'll learn more about this when you complete the Medtronic online course. Carb counting offers more advantages than following a strict diet schedule. It's a more precise method of managing blood sugars. It's more physiologic, and it allows for some flexibility in meals. It's the only way that a person can manage their blood glucose when using an insulin pump. It's important to note that not all carbs are equal, even if they have the same amount of carbohydrate grams. Therefore, some accommodations will need to be made for these differences. For example, a cookie with 30 grams of carb is going to raise your blood sugar more than a sandwich that has 30 grams of carb. Patients will get a carbohydrate budget. So again, using food labels, pocketbooks, and then pharmaceutical companies provide carb counters. There are fast food guides that are available at restaurants. Palm Pilots and apps can help patients precisely estimate the amount of carbohydrates in their food and take an appropriate amount of insulin to cover it. Carb counting will require attention to correct calculations. Although insulin pumps will calculate insulin doses, the individual will still need to put in the amount of carbohydrate that he or she is eating. Patients will need a food scale and measuring cups to make sure that they have consumed the proper portion size. Patients will need to be taught how to read food labels for carbohydrate content. Note that on a food label, they list the total carbohydrate in grams. They indicate how much of that is sugar and how much of that is fiber. total carbs should be what the patient focuses on. So rather than focus on sugar, focus on total carb. If the fiber is greater than or equal to 5 grams, that should be deducted from the total carb. So as you see here on this label, a serving size is listed as 1 cup. And they appear to have a cup based on volume rather than weight. It has 5 grams of fiber. So we would deduct the 5 from the 10 grams and say that this food per serving is going to give you 5 carbohydrate grams. It should be taken into account when calculating the insulin dose that's needed. This is because fiber doesn't contribute to elevation in blood sugar. We also want to consider fat in an item because fat slows the absorption of glucose. Insulin needed to cover the grams of carb in a cracker will be less when cheese is added to that cracker because fat will slow it down. The insulin to carbohydrate ratio is defined as the number of grams of carbohydrate covered by 1 unit of insulin. This number, the ICR, varies between individuals. When a person is initially given a ICR, they need to have close monitoring of blood sugar to make sure that they've determined the correct insulin to carb ratio. It's appropriately set when a postprandial blood glucose does not rise beyond 40 milligrams per deciliter. Make sure you remember that cut point. The insulin to carb ratio is used to determine how much rapid-acting insulin should be taken at meals to cover the amount of anticipated carbohydrate intake. They are used by individuals on physiologic insulin regimens or insulin pump therapy. In general, approximately half of the required dose of insulin is used for basal, or what we call background insulin, and half is used for bolus or mealtime insulin doses. The half used for bolus can be divided by 3, and 1/3 of the rapid-acting insulin dose given before each meal. The dose can then be titrated to meet target postprandial glucose needs. After target goals are achieved, to calculate the ICR ratio, the total carb grams eaten at each meal is divided by the units of rapid-acting insulin. So, if a person plans to eat 60 grams of carb, or 4 carb servings, it would be covered by 6 units of mealtime rapid-acting insulin to maintain a postprandial glucose in the target goal range. The ICR is 1 to 10 because we say 60 divided by 6 is 10. So the ICR is 10. Therefore, for every 1 unit of insulin, we would have 10 grams of anticipated carbohydrate intake. In another example, an ICR of 30 means that the person needs to take 1 unit of insulin for every 30 grams of carb consumed. Don't worry if this is a little bit confusing. You'll cover it in more detail when you get to the Medtronic online activity that you have to do. We want to mention the glycemic index. The glycemic index is a comparison of how much blood sugar increases after consuming 100 grams of a carb food compared to 100 grams ingestion of glucose. For example, dried beans, because of the fiber content, will have less of an impact on your postprandial blood glucose than eating a slice of bread. This table is a brief list of carb foods categorized by glycemic index. Generally, lower GI foods are healthier choices because they have more fiber. They slow down the absorption of sugar, and therefore you'll have less extremes in blood glucose. However, ice cream appears in the low GI list because of the high fat content that slows the absorption of sugar. Doesn't necessarily mean it should be encouraged on a diabetic diet. Research has shown that eating foods from the low GI food groups may be of benefit to fine-tune blood glucose levels. However, glycemic index can be affected by a number of factors. For example, A very ripe banana will have a higher glycemic index than a banana that's a little greener. Processing, the type of starch and style of preparation can all impact how much a food raises blood sugar after it's eaten. Creamed potatoes, depending on how much fat is put in them, will not, raise blood glucose more than French fries because French fries have more fat. Glycemic index can also be impacted by extrinsic factors. Eating protein and fat along with the starch, how much was eaten before the meal, fasting, insulin resistance, gastric emptying rates. So again, there's a number of things that can impact the rise of blood sugar after a meal. Even if the patient has followed their ICR recommendations and they've eaten and estimated the appropriate amount of carbohydrates, there can still be variations in the postprandial blood sugar. This is why so many patients now are turning to the insulin pump, as it can more readily account for these variations. Regardless of the factors that can impact blood sugar after eating a carb food, consuming more low GI foods appears to offer benefit in reducing risk of diabetes and management of blood glucose, as demonstrated in this landmark study. And again, this landmark study demonstrated the benefit of using low GI foods to even decrease the development of diabetes. I want to talk about another condition, hypoglycemia. It is defined as a blood glucose level less than 70 milligrams per deciliter. An individual who has hypoglycemia should be encouraged to eat 15 grams of glucose in any form, but especially a high glycemic index source that will get the blood sugar up quickly. We want to get the blood sugar up 45 milligrams per deciliter. If the glucose levels are less than 50, however, we suggest 20 to 30 grams of carb may be needed. And you see a suggested list of foods that would contain 15 grams of carb and would be from the high glycemic index. Response to treatment should be apparent in 15 to 20 minutes. At this time, blood sugar should be tested again. If it's still low, this treatment should be repeated. This is called the 15-15 rule. 15 grams of carb, check the blood sugar every 15 minutes. Unless, of course, blood glucose is below 50. Then you'd want to give more carbohydrate. Blood glucose levels should be tested again in an hour, as blood sugar may fall if food is not eaten within the hour. Sick day management. Even if a patient is ill and eating less food, they should continue taking insulin and monitor blood sugar more frequently. It's important to keep sugar-free and sugar-containing beverages on hand due to potential hypo and hyperglycemic events. On the slide, you see the general sick day management guidelines. To summarize, medical nutrition therapy will vary over time. There's, of course, the initial treatment in which baseline insulin levels are determined, the amount of carbohydrate that a patient needs, day-to-day variations, meal-to-meal variations, adjusting medications. These will all require very close monitoring. This is not a one-stop shop and go for the patient who has diabetes. It's very important to offer individualized care, considering the type of diabetes, how much medication, age of the individual, their education level, and support system. There are helpful websites that you can offer.